We live? Thank you. All right. So good afternoon and welcome to voting list number 20. It is Wednesday, April 2nd. This is the Health and Government Operations Committee. This is your chair, Jocelyn Peña-Milnick, joined by my vice chair, Bonnie Collison. We are going to start with the concurrence bills. There's House Bill 333, which is the Healthcare Ecosystem Stakeholder Cybersecurity Work Group. I believe that's Delegate Kerr. Is that your bill, Delegate Kerr? And this is a bill that established a healthcare ecosystem stakeholder cybersecurity work group tasked with developing strategies to prevent cybersecurity disruption to the healthcare ecosystem services, ensuring the continuous delivery of essential healthcare ecosystem services, and enhancing recovery efforts for the healthcare ecosystem following a cybersecurity incident. The motion will be to concur with a Senate amendment, and the Senate amendment basically corrects a typo in the purpose paragraph. All right? Any questions about that? All right. All those in favor say aye. Aye. Any opposition to concur with the Senate on a typo? Seeing none? All right. Let's move on to House Bill 664, Health Occupations License Direct Entry Midwives Disciplinary Action. Basically, the amendment makes stylistic changes, okay? It doesn't change the substance. Any questions on it? Move favorable. All right. It's been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none. The next one is House Bill 850, which is a work group on the creation of a data dashboard for public work contracts and apprentices, the establishment of that work group. And what the bill does is that, the amendment adds members to the work group, and it is concurred with the Senate. Any questions on that? Seeing none, there's a motion, there's a second. Any questions or concerns on that motion? All those in favor say aye. Aye. Any opposition? Seeing none, we concur. All right, that is it for concurrences, correct? Let's move on to House Bill 429. We do have that.
Did you do 991?
I have.
Yeah.
Oh, I didn't. Oh, it got stuck in there. Sorry. We do have one more concurrence. It is House Bill 991. Thank you, Lindsay. State Procurement Minority Business Enterprise Program Extension and Reports. What the amendment does, it is a motion to concur with the Senate. It alters the termination date for provisions of law applying to MBE requirements to sport wagering licenses. Okay, do you want to explain that a little more?
Sure. So this is the bill that extends the MBE program and the related disparity study. The subcommittee actually just voted on the same amendment for the Senate bill. This issue about the sports wagering licenses just came up after both chambers had passed the original bills, and the sponsor's aide, when he came in to testify on this bill, mentioned the need to add this additional extension.
Okay, any questions from anyone? Yeah.
Bill, is this what the one that's on the bottom of the vote sheet, the 829?
Yes. So the Government Operations Subcommittee just voted to add the same amendment to Senate Bill 829 that you'll be voting on shortly. The Senate is adding that amendment to House Bill 991, so they'll still be conformed.
Okay, so what does the bill do now, like the total bill?
It's still extending the MBE program and the disparity study 1 year. It's the sports wagering licensees are also required to follow the MBE requirements, and that's extending the deadline for them to continue to follow the MBE requirements by 1 year, or actually by 2 years.
The fiscal note mentions offshore wind and just.
Yep, those were already included in the bill. It's just various programs that comply with the MBE requirements, because the MBE program periodically sunsets. Those associated requirements have also been periodically sunsetting, so they're getting extended along with the disparity study.
Okay, thank you.
Okay, any questions? Those are good questions. All right, any concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing, Delegate Morgan, Delegate Shalega. Okay, all right. So let's go to House Bill 429, Health Facilities Delegation of Inspection Authority Nursing Homes. It's favorable with amendment. It is Lisa.
There are amendments on page 1 of your packet, and with these amendments, the bill requires that if the Department of Health is 6 months or more behind the federal requirement for conducting nursing home surveys, and county makes a request, then the Secretary of Health must delegate to the county the authority to augment state nursing home survey staff using county funds. The department will have 45 days to initiate a memorandum of understanding and develop a plan on how to implement the augmentation of staff, and the bill also establishes reporting requirements.
Vice Chair Collison.
Thank you, Madam Chair. So this bill, you heard the Senate version, and it was in the sponsor-only hearing. It went on a little while. Basically, what the bill came in as was an attempt to solve the issue that OHCQ was seriously delinquent in its inspections of nursing homes. And in the past, there's been a memorandum of understanding with Montgomery County, and Montgomery County was essentially doing, for about 10 years, its own inspections and was splitting the cost with the state. The current administration, when asked to renew that particular memorandum of understanding, said that it was more complicated than had been understood when the original MOU was signed, and that it would compromise, the bill as it came in would compromise their ability to continue to progress. I've been working with the department for 18 months on this bill. And I started with the Department of Health around what things they were going to put in place to fix it. And they have indeed put a number of things in place to fix it. And as a result, they have significantly progressed in their annual surveys required by CMS to of the nursing homes in the state. There are about 220 of them. In the last 18 months, they have completed about 110 of them, and they are on target to complete all of them, all of the required surveys by the 1st of June in 26. And there is a dispersal of, I know the question was raised during the senator's hearing that Montgomery County might be getting preference in order to, help quell the concern that the bill raised. If you look at the percentage of nursing homes that were completed throughout the state, the average completion rate in all the counties was somewhere between 35 and 50%. And Montgomery County was about 50% of it. So it wasn't like they were not an outlier in those percentages. So what we decided, or what I would like us to do, is to put in more accountability for the department in completing these inspections. One, by reporting every 6 months which nursing homes and when the surveys were completed for each locality to the departments of the triple A's. I know aging and HHC are two of the A's. I'm never sure what the other A is. Area Agency on Aging. So they're going to, right, thank you. They're going to report to them every 6 months on what they've completed. And in addition to that, they're going to give them a piece of data that tells how far along they are in the entire state. So, and that was added yesterday at the request of Montgomery County. So that accountability piece is added. The other thing, that instead of supplanting the responsibilities of the state, essentially, what we're doing with these amendments is allowing a county to augment them. So, for example, when I've talked with the leadership in Montgomery County, they're feeling like this is a much more fiscally responsible approach because they're going to spend less money, and the state's going to be more accountable for it. So, if they fall behind, and the definition of fall behind is or how that's measured is on page 3. And this is a term of art, the statewide interval in months. And so they'll be able to, each locality will be able to see whether or not the county has fallen, or the state has fallen behind in its inspections. And so they can then request to this option of augmenting the services. The thing that the county was most concerned about is there are 4 tiers of inspection. And the first is actually the most rigorous because it's actually a full, complete inspection of the facility. It takes about a week to do, a team of 4 people who go in. The next 3 tiers are related to the level of concern they have. So if in that inspection they find some areas of concern, then you move to level 2 in that facility. If you find an urgent concern, you move to level 3. So what Montgomery County was concerned about was they were not going to be able to progress through the tiers. We worked with the department and who communicated with CMS, who in CMS said they have the state has the authority to grant this authority to the locality to progress throughout the tiers. So so we resolved that issue. With that, the county is comfortable with these amendments and feels like we will meet the goal of making sure that all the nursing homes in the state are inspected in timely fashion and as required under CMS. I think the added benefit here is if we see that the state, we knew, I'm sorry, I'm interrupting myself, but we knew the state wasn't meeting its requirements. We've known that as long as I've been here, but nothing was ever done about it. And, you know, and I'm not placing blame. I'm just saying we've had this data for a long time and we've never done anything about it. I think what this bill does is raise this issue to a level of awareness where we will be tuned to it and we will address it much more quickly in the future. So with that, Madam Chair, I move the amendments.
The amendments have been moved in second. Are there any questions or discussion? I'm going to start with Delegate Hutchinson, then Delegate Johnson.
Thank you, Madam Chair. Delegate Collison, was the initial bill, though, just for Montgomery County, and is this now making it a statewide bill that any county can do this?
The original bill last year was Montgomery County. This bill this year, as it came in, would have applied to all counties, which was one of the concerns that is in the fiscal note, because if more than one, remember, while it's hard to reconcile when you say, oh, well, the state doesn't have to pay very much if they're only paying half of Montgomery County. That's still extracting money from their budget, and which means that they would have to fire people from their budget. If a lot of counties took them up on that, they would need a lot of, coordinating administrative functions, or people to do that, and they would also lose a lot of personnel. So,
is Montgomery County the only county that has been doing their own inspections?
I had heard once that Prince George's has done it, but I have since been told that no, they didn't, and Montgomery County was the only one.
Okay, I always thought I always thought we were talking about Montgomery County, but you sort of touched on it, but this gives me pause to say, because Montgomery County is the only one that's been doing it, that they would spend more. It was very clear from Dr. Kalialan-Rama that they did not want the original bill to go through, that they would focus more attention on Montgomery County so that doesn't trigger the ability to authorize you to go in and do the inspections yourself.
So is that your concern, that they would
just
do
a little
that?
bit of a slight concern. I mean,
So,
I'm not, in my district, I don't have that many
Yeah.
nursing homes that when we're not going to jump in and.
The data that will be used to determine how far behind they are is statewide. So it wouldn't relate to, they could finish all the nursing homes in Montgomery County, but if that interval, that state average interval is not met,
Got it.
they're behind.
Thank you.
Yeah.
Delegate Johnson.
Madam Chair. So first, aren't they receiving federal money to do this work?
They
And
are.
second is, I hear the accountability piece, but is there an enforcement piece? We know they've made great strides, but what happens if they just aren't keeping up or they don't keep up? And yes, they can create an MOU with another county, but a lot of counties can't afford to do this. So where are we left in all that mix? And are we going to get a copy of that report every 6 months?
For us, it's not every 6 months, it's annually to this
Well, you said they were going to
committee
make a
and-
report every 6 months to someone?
To the localities, so that
Oh,
they
to the-
know.
okay, locality,
how many
gotcha.
facilities in each of their localities have been
Okay.
done. In terms of enforcement, we're going to have the data. It's going to be up to us to determine whether or not, what we need to do on enforcement issues. But my point is, we're actually going to actively be looking at the data every year.
All right, thank you.
Thank you for the questions. Delegate Hill.
Thank you for all the work, first of all, for bringing the bill and doing all the work on this. And I really like that you changed it from delegation of inspection authority to augmentation of survey staff. I think that made them much more comfortable. But here's the thing, this is a dynamic process, right? So I can catch up on the ones I was behind and still be behind because somebody's now due. And when we're talking in the amendment about wanting to know the average statewide interval, I don't think the average is what we want to know. We want to know the range or something else because we want to know if they're behind. You can be behind and the average not show it. So I'm a little concerned about that. I'm a little concerned that when we ask for reporting on the memorandums of understanding, none of this starts happening until 2026. So they've got, 13, 14, 15 months to keep doing this with the department saying we think we'll catch up, but we don't have anything in here. I don't have a sense of when we expect them to be caught up by, right? So it says if you're still 6 months behind, in a year and a half, if you're still 6 months behind, and it's going to take you another 2 months, 45 days for the MOU to go out, and then you have to do a plan, how are you projecting we're ever going to catch up?
Well, first of all, they expect to have everyone done by the 1st of June next
Okay.
year in '26, and that's why.
And then the new, meaning
Right.
the new ones
Then
that
they
were
would be
inspected in
starting-
2024
Right.
are ready to be inspected again.
Exactly.
Okay.
Exactly. So, so they would know within 6 months whether or not they're behind. And the counties will know within 6 months whether or not they're behind. So,
But they can't do a memorandum of understanding till next June.
well, it would actually be, the process could begin in next June, potentially, if they haven't caught up, right? But if they have caught up, then they get 6 months to make sure they stay caught up. And if they don't, at the end of 6 months, then there could be the applications for the MOU.
Okay.
So we're talking probably, the earliest an MOU could come on board is 2027.
Okay.
But I guess I would stress in terms of they are making good progress. They've made significant changes in their operation, and they have a fiscal responsibility to meet these inspections there, and we want to hold them responsible for it.
So I guess what I'm asking, I know what I'm asking, is I understand that they are making progress and they have good intention. As you said, they haven't been caught up since 2020, right?
Yeah.
I'm wondering why we're comfortable giving them almost 2 years before we're going to augment their staff to get them up. It seems like a long time to give them before we're saying we have to, you need help and we're going to help you.
So they haven't, thank you for the questions, Ellie. I do appreciate it. They have not been fully staffed. They hired a group of temporary surveyors through a company that has, they hired 15 of them to get to where we are now. They have 45 staff members now, and they have 15 in training. It takes about a year to train the surveyors because they have to, they do it on-site training in addition to, didactic training. It's also on-site practice with the rest of the team. So they will have a full complement of folks, I think by August is what I was told, and of their own folks, but they're not letting go of the temporary people until everybody's caught up. And once they have a full complement, then the expectation is they're going to be able to meet their requirements.
Okay, so I'm not trying to be difficult, if I may.
I think, Delegate Hill, in the interest of time, and we have a whole lot of bills, and we have to be on the floor at 4 o'clock. And the
4:30,
fact that
4:30.
Vice Chair Collison, what is it?
4:30.
4:30, the Vice Chair Collison has been working on this, and I'm gonna support her on this and give and trust that, she's working it out. Also, the fact that the department, if we have to be frank, for decades, that particular office has been a mess. And I can tell you that personally because we experience it in this committee. They have a new person that is leading the department. The department is committed. And I think that I feel comfortable giving them the time to work it out. They have been hiring people, all right, that they didn't have before, and they're taking steps. So we're going to be back here in January. All right. Who knows? We may be here before then. In all honesty, I'm not speaking for anyone, just for myself. So I think, that I would like to just let it be for now. Okay?
For the record,
Yes.
my concern is not that they won't catch up.
Yeah.
My concern is for the people who are in the nursing homes, who are the last ones in the next year, who are going to get inspected. And that why we couldn't do this and still ask them to do a temporary 6-month one or 1 year with Montgomery County who's willing to do it, starting as soon as possible to help them catch up because those nursing homes and those residents aren't being taken care of until they get to the end. That's all. It's fine that they're catching up, but there are people on the end of not being caught up. That's all.
We don't have the staff in Montgomery County now to be able to do it, so it would take another year for them to be ready. Whereas they can be, watching what happens and how it unfolds to gear up, but they'll know that the potential is there. Yeah.
It's a reality we have.
Right.
It's a reality. We have a shortage across many different areas. Delegate Shalega.
Thank you. I just want to, in my mind, again, understand the timeframes. So I remember him sitting there. I asked, how long does it take to do the nursing home inspection? He said 4 days, lots of people reading the granularity of the inspection. How often are they required to have a full inspection?
Under CMS rules, every 16 months.
Okay, so every year and a half.
Right.
But right now, there's some that I looked online hadn't been done in years. So you're saying that a year, in 16 months from now, no longer than that, yeah, you said June of 26. They'll be caught up statewide.
What they're telling us, yes, given their full staffing and the new processes that they've put in place.
For the 16-month requirement, or will it just, they will have gotten through all of them in a certain amount of time?
I'm not sure I'm understanding the question.
So June of 2026.
Right.
The department is telling you that they will be caught up.
Right.
So that means everyone would have had an inspection between January of 2025 and June of 2026.
Well, and they began, actually, it'll be between the summer of '24 to catch up, because again, there's some lag time because of getting up to speed in terms of staffing. So it's going to be, will have taken them 2 years to be complete. But after that, they'll be able to do it every 6 months because of the changes, at 16 months because of the
Okay.
changes they've made.
Okay, and we're just going to trust but not verify.
We're verifying with the reports that we're getting. And each
Okay.
of our localities is getting reports as well.
Okay, and I just want to point out for the record that according to AI Overview, not Dr. Google this time, yes, states, I asked, are there private contractors to do nursing home inspections? You know, if you can't train up enough state employees, why can't we contract this out to Montgomery County or some private entity? Yes, states are increasingly using private contractors to conduct nursing home inspections, often due to staffing shortages and inspection delays. So keep that in your back pocket.
Right.
If they cannot catch up, then we need to do something, because I
Right.
agree with Delegate Hill.
Right.
There are people at the end of those inspections, and we, as a state, need to ensure that those people that live in nursing homes are, you know, getting, those nursing homes are being inspected. Thank you.
Just so you know, that's how they are catching up. Because they were low-staffed, they didn't have enough staff, have actually hired private company to help them catch up. But they will be fully staffed by the wintertime.
And I was going to say that, I didn't want to interrupt you, that they have done that because they're just short-staffed. All right, any other discussion on the bill? Okay. Is there a motion on the amendments?
As amended.
Well, we haven't voted on.
No, the amendments. Can you move the amendments, please? Amendments have been moved in second, and we have had a discussion. All those in favor say aye. Aye. Any opposition to the amendment on the bill as amended? It's been moved in second. Any questions or concerns? All right, seeing none, it passes. We're going to take the department at their word. We're going to give them the time. They have hired people, right? They're training people, and he said how, the intense the training is. We do care about the people that are in nursing homes. This committee cares very much about everyone, but we want to give the department the time, and we're going to get to revisit it, okay? And your points are valid, okay? Thank you. And who does not want to be on the bill? Can you raise your hand? All right, everybody wants to be on it. I want to thank Delegate Vice Chair Collison for your work. And I mean, I know you put a lot of hours into it. So I want to thank you on behalf of the committee, okay?
You want to do the cross-file?
Yeah, let's do the cross-file while we're at it. What is it, 376, Senate Bill 376? And I want to thank the senator as well for his hard work and his commitment and caring and his passion. This is favorable with amendment. Lisa?
So the amendments conform to what we just passed.
Amendments conform to House bill. It's been moved in second. All those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. Bill has been moved in second as amended. Any concerns or questions? We're going to note the same concern to this one. All those in favor say aye. Aye. Any opposition? All right. Let's move on to House Bill 957. Delegate Chair Wilson, State Procurement Worker Residency Requirement. Favorable with amendment. Lindsay.
This bill establishes state residency requirements for apprentices on state contracts. The Department of Labor is responsible for enforcing the bill's requirements, and costs incurred to administer the bill must be paid from the State Apprenticeship and Training Fund. Contractors found in violation of the bill's requirements are subject to financial penalties and debarment. There's a reprint of the bill with amendments adopted in subcommittee on page 4 of your packet that limit the application of the bill to covered large projects, meaning public work contracts subject to the prevailing wage law valued at $5 million or more, located in Anne Arundel, Baltimore, Howard, Montgomery, and Prince George's counties, and Baltimore City. does not apply the bill to state contracts for which the federal government provides money, alters definitions, makes the only residency requirement that a contractor for a covered large project must ensure that 35% of the apprenticeship hours are performed by state residents, authorizes contributions in lieu of fulfilling the apprentice requirements to be made to the State Apprenticeship and Training Fund, in addition to or registered apprenticeship program, authorizes a contractor that exceeds the residency hour requirements on a contract to apply those hours to another covered contract within 2 years after completion of the first contract, alters the method of calculating the financial penalty for failing to meet the requirements of the bill, and authorizes debarment if a person is found to have violated the requirements 5 times in a 5-year period rather than twice in a 10-year period.
Okay, Delegate Kerr?
Thank you, Madam Chair. This one took some work. And
Very hard,
and
very hard.
and then we accepted an additional amendment in subcommittee from Delegate Hill today. All stakeholders were present at the subcommittee, and I think the subcommittee's confident that all the differences were worked out. So let me move the amendments.
Amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition on the amendments? On the bill as amended? The bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? All right, who does not want to be on the bill? Delegate Shalega, Delegate Morgan, and Delegate Riley, Delegate Kipke, and Delegate Hutchinson, and Delegate Chisholm. Okay, all right. And I'm going to thank you on behalf of Chair Wilson, because you worked really hard, very hard on this, you and staff. Thank you. House Bill 1468, Cyber Maryland Program Revisions, favorable with amendment. Lindsay and Kerr. Lindsay.
This bill, as introduced, transfers the Cyber Maryland program, including the Cyber Maryland Fund and Cyber Maryland Board, from TEDCO to the Department of Labor. The amendments that are in your packet are actually on page 39. They are a reprint of Senate Bill 867 because the amendments to the House bill will conform it to that bill with an additional amendment. The amendments adopted in subcommittee alter language for the awarding of competitive grants or contracts under the Cyber Maryland program, authorizes rather than requires the governor to make certain appropriations, requires the program to seek alternate funding sources from sources other than the state to supplement the fund, repeals the requirement that unspent balances of certain programs and funds be transferred to the Cyber Maryland Fund, requires the board to adopt bylaws on membership rather than specifying this in statute, requires the program in conjunction and collaboration with certain entities to report on cyber workforce program activities, establishes the intent of the General Assembly that amounts awarded in grants and contracts may be allocated for certain cybersecurity clinics and specifies the goals of those clinics, and that the balance of the fund be used to implement initiatives approved by the Cyber Maryland Board, and alters the effective date of the bill.
Okay, Delegate Kerr.
Thank you, Madam Chair. This bill was waiting, the money for the bill was in the budget, but we had to wait to see if it stayed in the budget, and it did stay in the budget, so the bill's ready to go. I move the amendments.
The amendments have been moved in second. Any questions or concerns on the amendments? Seeing none, all those in favor say aye. Any opposition on the amendment? Seeing none on the bill as amended? The bill has been moved in second. Questions or concerns? Delegate Shalega.
Thank you so
You're
much.
welcome.
On handwritten page 42, at the bottom of the page, this is current, providing grants to elementary, secondary schools, institutions of higher ed, including community colleges. This is the new language. Employers, including apprenticeship, blah, 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 labor unions. So why are we giving labor unions money?
I don't have the answer to that question.
So it was in the original bill, it was the way that the sponsor, as you know, when we put our bills, we negotiated her bill and introduced it. Right? We have no other answers. Okay? Question it. Yep.
Yeah, I didn't, I just saw it, so.
Yeah.
I mean, money above it, money transferred to the fund. So does this mean that the taxpayer dollars are going to go to labor unions to fund their cybersecurity?
The apprenticeship programs, everyone benefits in Maryland.
Sure, they have non-union and union apprenticeship programs. I'm well aware of that, but that's not under apprenticeship. That's a separate line. It's labor union standalone. Industry associations, labor unions. I don't know whether industry associations should be in there either. I mean, they should be paying for their own cybersecurity, in my humble opinion. On handwritten 42.
All right, so that did not come up, but I can see why they will be in it, right? Because we want to, be able to help, especially organizations that train people to do these work. And government sometimes does that with a lot of different people. We do a lot of, public partnerships and a lot of different partnerships as well. I've seen this before in other bills, but it didn't come up during the hearing and it didn't come up during subcommittee.
Could I make a motion to strike that, both of them, industry associations and labor unions? Or I will make a motion to entertain an amendment to strike industry associations and labor unions.
My guess is that there are cybersecurity industry associations that would be.
A second. You second?
Yeah, but labor
Okay.
unions?
So there was a motion to strike it.
I'm just saying,
Okay, there was a motion to strike it. I would,
And there is a
we're going to
second.
open it up for discussion, okay? And there was a second. It was done by Shalega, Delegate Shalega, and it was second by Riley, correct? For the record, Delegate Bandari.
Thank you, Madam Chair. I do agree that labor organization must be on the table because they're essential partners, as Chair highlighted in workforce development. And with the cybersecurity emerging as a critical industry, there's registered apprenticeships and existing working training, and this talent pipeline development cannot succeed without labor's expertise and infrastructure. So I think that should be there.
Okay, so anyone else? And I would add that in the bill, it says that the department shall adopt on page, the bottom page 42, line 29, it says the department shall adopt standards to award grants under this section, all right? So they have to have some criteria to be able to award it. And I would say, for the same reason that Delegate Bandari stated, that these organizations, nonprofits, unions, they train people and they provide, we might not all agree with them or support them, but they do play an important role in society, and not everyone, has access to them, right? Some people do, and you get some good jobs that are solid middle-class jobs, and you get good salaries, you get health care, which this committee works very hard at as well. So I would argue against it. I know I have Delegate Hill next.
Reading the whole, the whole thing, line 8, the fund is a special non-relapsing fund that is not subject to the state finance procurement article. They're separately, and the fund consists of money appropriated to the state budget and may be used for administrative expenses and providing grants to elementary and secondary schools, institutions of higher education, including community colleges. It used to say for-profit corporations and not-for-profits. And now they've added a whole list of other entities that might provide the apprenticeships, which include employers and unions and labor union, local governments and workforce. I mean, I think it's just an inclusive list.
It's comprehensive.
It's comprehensive.
As well. You
think
can't
if we
take
pull-
one and leave the others.
Once we pull one out, it's
very
not comprehensive anymore.
Okay? All right, so the motion has been made and second. Yes, Delegate Shalega.
Because it's in with employers, I'll withdraw my amendment. But I would like to say that I don't think any of them should be in there. So,
Okay.
my 2 cents worth.
All right.
I mean, I think community colleges, higher ed, that's fine, because those are appropriate uses of taxpayer money. But when you go through the rest of the list, some that's current language and some that's new language, I would say that, in my opinion, that's taxpayer dollars shouldn't be paying for that. So, thank you.
All right, so you withdrew the motion. All right. Do we have to take a vote on that or no? All right, great. So let's go back to the bill as amended. Second. Okay, so moved in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? All right. Who does not want to be on the? Oh, okay. All right. So it's okay. All right. So who? All those in favor say aye. Aye. Who's opposed to the bill? Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Okay? All right, thank you. Who does not want to be a sponsor? Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. All right.
And do you want to do Senate Bill 867 at the same time?
And while we're at it, let's just, because we like punishment, let's go, what is the bill number?
So Senate Bill 867 is the cross file. It's the one that you actually have a reprint of in your packet. So the only amendment that's needed on this one is the addition of the Adjutant General to the Cyber Maryland Board.
All right. So we move to conform them. It's been second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? On the bill as amended? It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? All right, Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Thank you. Thank you very much for the discussion. All right. Let's move on to, which one is it? Senate Bill 127. It is state government grants contract reimbursement of indirect costs. It is favorable with amendment. It is Lindsay and Kurt. Lindsay.
So this one actually did not go to subcommittee. The bill repeals a requirement that a state grant or contract funded wholly or by state funds or with a combination of state and other non-federal funds and awarded to a nonprofit organization that has not negotiated and received a specified indirect cost rate allow the nonprofit organization to reimburse indirect costs at a rate equal to at least 10%. Instead, a nonprofit organization may reimburse indirect costs the greater of the de minimis rate established in specified federal regulations, which is currently 15% or 15%. The bill, as it came to us, terminates June 30th, 2028. The amendment on page 13 in your packet. So the reason this is coming here is the bill is not amended identically to House Bill 300, but the bills are going to be amended to match. The amendment in your packet makes the bill an emergency bill, which was done on the House side to House Bill 300, and it removes the 3-year sunset provision that was put on the Senate side. So that will make this bill identical to House Bill 300. The Senate on House Bill 300, to let you all know, is going to remove the study language that you all asked to have added to House Bill 300 because that was very costly.
Fiscally. And I remember, I think Delegate Shalega, you made the motion and we took it. It is just that it will be fiscally prohibited. And that's what we heard from the Department of Budget and Tax, correct? Budget and Management, sorry. Anything you will add, Delegate Kerr?
These amendments just take the best parts of both bills and merge them together.
So you move the amendments?
I move the amendments.
The amendments have been moved and second. All those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended? The bill has been moved and second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Shalega, Delegate Morgan, Delegate Riley, and Delegate Kipke. Okay? All right, so we have next Senate Bill 294, Maryland Cybersecurity Council alterations. It is Lindsay and Kerr, favorable with amendment.
This is another one that was not identical to its cross-file. The bill modifies the membership, organization, and duties of the Maryland Cybersecurity Council. The bill expresses the intent of the General Assembly that the council review and adjust its subcommittee structure if necessary and implement appropriate bylaws of operation consistent with state law by December 1st, 2025. The amendments that appear on page, or they start on page 16, but the relevant language is on page 19 in your packets. Add one additional member to the council and then just sort of restate the language around the 2 representatives from USM.
Delegate Kerr.
Thank you, Madam Chair. This bill didn't require any additional work in subcommittee. I'll move the amendments.
Amendments have been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition on the bill as amended? Bill has been moved and second as amended. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition to this bill? Seeing none, the bill passes. Let's move on to Senate Bill 309. That is actually favorable. Lindsay and Kurt.
This bill was not cross-filed. It expands the communications, outreach, and advocacy program in the Department of Veterans and Military Families to include providing services to service members and the families of veterans and service members. The Secretary must include in the annual report a general assessment of communication methods utilized to support the program, and the bill alters definitions related to the military. There are no amendments, and it was a 42-0 Senate vote.
Okay, Delegate Kerr.
This was another bill that came to us in good shape. So I move the bill.
An error. We had quite a few of his. Actually, they were all really good bills. So it's been moved in second, right? Did you move it? Move in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? Seeing none, the bill passes. Let's move on to Senate Bill 459. Favorable, Aaron.
It's identical.
Bill has been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, Senate Bill 740. Favorable with amendment. Aaron.
This bill was not cross-filed. It did not go to subcommittee. It authorizes each healthcare facility to screen each patient for information on the patient's eligibility of a service member, community member, and include the information in the patient's medical record. For the purpose of improving healthcare quality for service member community members, each healthcare facility may identify service member community members as a vulnerable population and comply with the standards associated with the National Patient Safety Goal to improve healthcare equity established by the Joint Commission. The amendments that are on page 26 of your packet conform the definitions of service member and veterans to how the terms have been defined in other veteran-related bills that have passed this session.
I remember this testimony. This was the young widow, right? Yeah, very, very impactful. This was actually, is there a motion on the bill? Amendments?
There are amendments.
Oh, I'm sorry. I apologize. So the amendments have been moved in second. Thank you, Delegate Taveras. Any questions or concerns on the amendments? All those in favor say aye. Aye. Any opposition on the bill as amended? Delegate Taveras, go ahead.
That's amended.
All right. Is there a second? Wonderful. Any questions or concerns on the bill? All those in favor say aye. Aye. Any opposition? Seeing none. And it's a Senate bill, so we cannot get on it. All right, Senate Bill 773, it was favorable with amendment. Lisa.
There are amendments on page 30 of your packet that conform the bill to House Bill 1246.
Is there a motion on the amendments? The amendments have been moved in second. Any questions or concerns on the amendments? All those in favor say aye. Aye. Any opposition on the bill as amended? It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition on the bill as amended? Seeing none, the bill passes. Let's move on to Senate Bill 773. Lisa.
We just did that.
Oh, that's the one we just did? I'm so sorry. Senate Bill 829, favorable with amendment. Lindsay.
This is the MBE bill that we discussed the concurrence for earlier. The amendments alter the termination date for provisions of law applying MBE requirements to sports wagering licensees. We did the concurrence for House Bill 991 earlier. The same amendment is being added to the Senate bill here. So this issue wasn't raised until after both of the bills had crossed. So we're both adding the same amendment.
So we did the concurrence for.
So we concurred already on the Senate
House
amendment.
bill.
This is us adding that amendment to the Senate bill.
All right, all right. Any questions or, well, we have to do the amendments, right? Move the amendments, okay. Any questions or concerns on the amendments? Seeing none of those in favor say aye. Aye. Any opposition? All right, on the bill as amended, Delegate Hill.
On the bill to be moved.
Okay. All right, it's been moved in second with her special language. I like it. All those in favor say aye. Aye. Any opposition? Seeing none. All right. Oh, opposition? Okay, so Delegate Shilega, Delegate Morgan. Okay, all right, that's it. Yes.
On the last bill, because you were rolling so quickly, I missed it. Senate Bill 773, I'd like to be recorded as no.
773 is health benefit plans, calculation of cost sharing requirements. Okay.
Thank you.
You're welcome. All right. Oh, Delegate Shilega?
Consideration, Delegate Kipke, can you explain your no vote?
I think we, well, Madam Chair.
Go ahead.
Okay.
Thank you for asking.
The reason is I prefer the way that the Senate passed the bill than the way that we passed it. And I can elaborate if you want.
No, that was what I was getting at. So we took Hershey's, what Senate Bill 773, Hershey's bill, has been changed to the House version, and what you're saying is you prefer the Senate version.
Right, unless there's been some agreement with the Senate that I'm not aware of.
Delegate Vice Chair Carlson.
Thank you, Madam Chair. I can say that we are still working on it. This is the product. In fact, I had a conversation with the senator just before this to say that we would like to bring in a couple of experts to understand these programs better, because we have different understandings of how the programs work. And it's much more complicated than it would seem on paper. So with the senator's indulgence, we will have a
conference committee to work it out.
I would also like to be a no, so when the conference committee meets, there's additional.
Would you like to your vote to be reconsidered?
Yes, please.
Okay.
Reconsider.
All right, so let's reconsider. Delegate Kerr.
On a different bill.
Excuse me?
It's on a different bill. I have an answer
okay.
about.
Hold on 1 second, please, 1 minute. So we're going to reconsider the vote so that you can get it right. All right? So again, on that vote, on that bill, Senate Bill 773, let's do it again. In opposition, Delegate Shilega, Delegate Morgan, Delegate Kipke, okay? All right. Thank you. You're welcome. Delegate Kerr.
Thank you, Madam Chair. I have an answer about the cybersecurity bill. The monies for apprenticeship programs, if they operate cybersecurity programs based on the strategic plan of the program, they qualify for workforce grants.
They qualify for workforce grants. Thank you. I will consider changing my vote on the floor. I'll keep it no for now. But thank you so much.
Delegate Kerr, you're ready for the floor. Okay? All right. That's what you get when you do the work. Just kidding. Delegate Hill.
I have a question, since we happen to have the sponsor of the House cross-file of SB 773 in committee. This discussion about the two versions in conference, I'd like Delegate Johnson to, isn't that your bill?
Sure. We're very close. It's only over one issue, and that is the coupon or discount for the whole plan year. So that's the only sticky point that we're still trying to work out. Everything else we've gotten worked out.
And what's the status of the House bill right now?
House bill says that they must provide it for the whole plan year.
And the House bill is being held right now, they haven't voted it out yet?
That's
No.
correct.
Okay, so we have.
So our goal is to send this back, go to conference committee. Before we came, you don't know it, but one of those 100 meetings I have a day was a conference call with the advocacy group and the Prescription Drug Affordability Board director. And we literally were talking two phones, and Delegate Vice Chair Collison and I and Lisa, to see whether we could come to some agreement. And Delegate Johnson, I apologize. I figure I just forgot about it. But I know that you and I met with the sponsor of the Senate bill in our office, right? And we talked about it. So the goal is to end up in conference, bring the experts, and see if we can work it out.
That's great. I just wanted to confirm, and I think you just did, that they are moving his bill too. So as we're moving the Senate bill, they're moving the House bill on the other side.
Well, what's going to happen is, since we're sending his different than he sent it to us, we're going to end up in conference. Yes, we're not moving it, but we're going to end up in conference. They're going to say they don't concur, and then we'll have to put together a little committee. They would meet with them.
I wanted to know if we're going to have conference just on the Senate bill, or if Delegate Johnson, who's worked so hard, is his bill going to be part of the conference too? That's what I'm asking.
Oh, it always is. When there's disagreement, when the bills do not match, you have a conference on both policies. Right?
They would have to conform the Senate bill to the House bill to the Senate bill and send it back to us. I don't know for sure that they're going to do that.
We're conforming, and there's nothing to protest unless.
No, but we are conforming the Senate bill to our bill.
Okay.
So his bill looks like ours. So he's going to say,
His bill to the Senate.
Right.
We're conforming their bill to ours.
that's right.
Thank you.
And then we end up in conference because there's disagreement. Okay? Yes.
You end up in conference.
The goal here is to help the citizens. So if we can come to an agreement on this last little thing, I don't care how we move it forward. Let's get it done for the citizens of Maryland.
You end up in conference.
Hold on, guys, 1 minute, 1 second, okay? Go ahead. Who wants to go?
It's not my bill, but, so technically,
But
you
she has the
actually,
microphone.
you only end up in conference if one side or the other refuses to concur. So hypothetically, if you send this back and they concur, then you don't go to conference. So you go to conference if you refuse to concur and appoint conferees.
But what I was saying to you is that because we made his bill mirror our bill, he's not going to concur. So it is the choice, it's not mandatory. It will be his choice, his committee, whether they want to go to conference or not. It is not mandatory. Am I right on that? Okay? So our goal by doing this is that he will say, let's go to conference. And we have spoken with him. And we have spoken with the advocacy group and said, could you be so kind and let the senator know that we want to go to conference? Because we want to sit down, because we want to do what Delegate Johnson said and work it out. Okay? Thank you. You're welcome. Any other questions? All right, we are done with the voting for now. However, there's still some bills that came out of rules. We've been really good in moving everyone's bills out, right? So we have some new bills that came from rules, and we have, is there a subcommittee left?
Yeah, tomorrow morning.
Public Health is meeting tomorrow, so we still have work. We do not have hearings, okay? But pay attention to subcommittee announcement and to those bills that came out of rules, whether we send them to subcommittee or they come straight here. It truly depends on whether or not they've been crossed, right? Are they in the same posture or not? Delegate Kaiser.
Thank you, Madam Chair. When we were in Government Operations Committee before on my IT modernization bill, there was one outstanding issue which has now been agreed to with the Department of Information Technology. So, I mean, I know that Chair Kerr has seen it as well, and staff has seen it, and it looks to be, makes the compromise, so hoping that that can move pretty quickly, because we were pretty much ready with the amendments and to vote on it, and we held back because of one little piece, so that's now ready.
We should be able to vote it tomorrow. Okay. Right?
Thank you.
Okay, yeah, we'll vote it tomorrow. We'll have a voting session at some point when we get off the floor. Any other questions or concerns from anyone? This is the time. All right, you have a little time, 3:11 before 4:30. Enjoy.